our Floresville location and throughout our whole entire network. As Monty mentioned earlier, and Sherry alluded to it too, we offer what is called a sliding scale fee discount program. And that is being subsidized for our 330 grant that we get from HRSA. And what that does, it enables us to see every patient. So no patient is denied for the inability to pay for services. Our sliding scale discount program is based on two criteria. We review the patient's annual income plus their household size. So they can qualify for paying only a nominal fee of $30. For example, if their services run up to $400, we can discount that all the way down to just the nominal fee of $30. But those are for those patients that are indigent care or at 100% or below federal poverty level. And then from there, the scale goes up to 25% discount on total charges, 50%, 75% to no discount at all. The next payment source in the sliding scale fee is available to those that are uninsured and underinsured. And underinsured is for patients who have private insurance. However, their deductible is very expensive. Like my deductible is $6,000. So if I was in that category, I can actually qualify for the slide as well. In addition to that, we also accept Veterans Choice. And we participate with Medicare, Medicaid, and we like to actually take credit for this. We try to accept most of the commercial insurances out there for all 5 of our counties in which we serve services. This next busy slide is some historical data. It's basically wanting to show you the volume patient that we saw at our Floresville location. Drilling down to the year 2015, we saw 2,261 unduplicated patients. Those patients came into our center, almost 7,000 visits during that year. As you can see, we're climbing upward. In 2017, I'm happy to say that we closed the year at 2,958 unduplicated patients with almost 9,000 visits at our Floresville location. The top line there is its future. If we are fortunate to get a location to build a new facility, it would give us the room for growth. With the growth, we can anticipate seeing at least 4,500 patients in a year, which equates to about 14,000 visits in 1 year. And that's providing medical, dental, and behavioral health services. Now, the type of patients that we serve is a mixture. Down at the bottom is our payer mix. For 2017, those 2,958 patients, we saw 36% of those were self-pay. When in the self-pay categories are those that can afford to pay for the service, and 50% of those are indigent patients or those that can qualify for the slide. And then the rest of the makeup is 19% Medicaid, 5% Medicare, and the special programs is 14%, which were the ones that Sharon mentioned in her presentation. And just to throw in a little note here, most of the time, patients who qualify for the special programs like our primary health care grant from the state, the Healthy Texas Women, they are also considered by our 330 definition. Those patients are uninsured patients as well. So as you can see, we have 50% of the patients that we serve at our Wilson Clinic are considered uninsured or underinsured. This next slide identifies the volume of employees that we currently have at our Floresville location. As you can see, in 2015, we only had 12 employees working for us. In 2017, we increased that to 18. The cost of those 18 employees is $936,098. And again, hoping to move to a larger facility, we can possibly add an additional 4 new employees. Out of the 4 new employees, we're looking at increasing our provider staff by 1 physician and plus their support staff. So we'll be looking at 22 employees or more at that facility, depending on what we can go into. And the cost of the 22 employees was $1,144,000 annually. And so with that, I'd like to turn that back over to Monty.
Thank you, Maria. And one of the things, remember, when we talk about the future, that's just the beginning of the future for us. If we can get the right land, get the right place, to build the right facility, the sky's our limit within there. I started out at Agricultural Health Center in 2004. When I started, we were at the Pleasant site only. We had under 40 employees there. I see the vision up here of Floresville being equal to or bigger than what Atascosa is. Right now, we are at over 60 employees. We have over 7 We have 7 medical providers. We're hiring a second dentist right now, and we have behavioral health there as well within there. And I can see that here. So we're looking at that, say, how can we grow within there? Like I said, the facility we're in, it's met our needs. We moved in there in 2007. We built out about 6,000 square feet of that, and we want to do more than that on this one. We want to start what we can and build up. Need to add new providers. The impact of Eagle Ford Shale, everybody knows that. That's hit us within there. Traffic in our location, funding. That's what we want to go at. That's why we're looking at our partnership. We want to be able to go out to different funders and ask them, and they'll say, well, what is the local community doing for you? And we'll be able to say, this is what they're doing. We did this in Karnes County, we did it in McMullen County, and we want to do it here in Floresville. I really see a big future here in Floresville, how we can really impact the healthcare. Because what Sherry went over, you can see the impact right there alone, and that's your neighbors and your friends that we're hitting and working with them on there. So this total health wellness, that's what we want for here, within there. We have growth, increased, move, it's the same thing I talked about. Wilson can equal bigger than Atascosa Health Center, Pleasanton site within there. This is our timeline, what we're looking at trying to do. We want to do it in the next 6 months, try to identify a partner here. We're asking you, can you help and partner with us? That's why I met with Tommy, just said, I don't know, well, let's discuss it. Let's bring it to the board and see what the board can do. Is there land that you can partner with us on within there and move on that? I know when we went into Karnes City, they gave us the land for $1 a year for 10 years. And that's what we've been doing there. Now we're just looking at building a new facility there within there. So within there, once we get that, we're going to look at funding and how we can do that. How do we get this project done? We're looking at, we have a good relationship with USDA. Maria and I have worked a lot with them. We bought a facility up in Lytle through USDA. We're funding the Karnes project through USDA. And of course, talking with Claire, he's been very supportive of us. He helps us get these funding through USDA. And we gave him a very good rate. And that's what we would do for this project. We were going there. Maria has handouts. Can I give you a little bit of the layout, what we're looking at building within there? We are already doing this, building it. So the cost would go down if we do the same thing, build the same building here that we're going to build in Karnes. But the beauty is we can add on to it. This is a start. It's a little under 8,000 square feet, but it's more built to a true integrated behavioral health, primary care, dental facility, one-stop shop within there. And we can even look at bringing what Sherry brought, the 340B pharmacy program. We can bring that here to Floresville also, which saves our patients thousands of dollars within there on the medications and stuff. I just surprised how much it saves within there. And, you know, by June 2019, thing works out, I didn't buy a contractor, I did type in 19, had to look closer at it. And then hopefully by 2020, we're moving into the building within there. That's kind of like the time frame. It's a movable time frame. It takes time to do these things. Our Karnes project, we've been working on that for years within there. And Christina knows, because Christina was our practice, and still is our practice manager over Karnes, and now she's taken on the Wilson site as well within there. And that's what contributes to these numbers. It's the desire of the practice managers to say, let's get the patient in, let's get the patient seen within there. Let's don't turn the patient away within there. And working with the providers to do that within there. And then with Dr. Thompson on board, I don't know, I can go on and on and on, but I know time is limited. What we're here to ask is, do you want to partner with us and be a true partner? Can you do that? We've looked at the land. I've been here before through the council way back in 2008 and 2009. And we're just asking again is, do we want to partner? What are we looking for? And what does that mean to your community within that? And you can see by what we showed you, the impact that we've already made, because that's what we see. Everybody comes to. I've had people ask me, Monty, I have really great insurance. What can I do? Can my family go there? Oh, can I go there? And the answer is yes. We're there for everybody. Just like what Maria pointed out, we take all the insurance companies. And the beauty is, if you're underinsured, can't afford that deductible, we'll still see you. So,
May I ask a question? May I ask a question? In the cities where you're already established, how has, sorry.
You're ahead of me.
I didn't mean to get ahead of you, but in the cities where you're already established, how have you affected other medical services in the city or in the area?
In the other areas that we're at within them,
Where you're established today, how have the other medical centers been affected? Because they're obviously at the same customers. So are they going to you instead of to other medical facilities in the city?
Sure, they do. I mean, that's a great question. I've had by other providers, you're coming into our community, are you going to compete against us? Absolutely, yes, and that's what I tell them. When we went into when we came into Floresville, the answer was the same thing. I met with the medical staff at Cogley Memorial, talked to them, the dentist was there also. They said, are you bringing in dentists? I said, yes, we are. But they said, well, good. They were very supportive of that. When we went into Karnes County, Christina was there, I mean, we talked to them, we told the doctors there, yes. But we're there to see everybody within that. And it's, well, we see everybody already, we really don't need you. Well, if you go through the Head Starts and we talk to other people, that's not always true within there. And that's what we did. And I said, and so the answer is yes to your question. Yes, we do compete against them, but yes, we bring cost affordable health care also within that. And there's, you know, another thing I tell them? Look around you. There is plenty of business around you. People need all of us. And as a team, we can work together. They welcome, like when we put Dr. Salazar in Karnes, they welcome him. And the same thing when Dr. Ponce came here from Polk over here and helped us open up this practice here, and Stacy Denver from Seguin, she came in, that's a nurse practitioner. They helped us open up Floresville. And the medical staff here at the hospital and the hospital administrators at the time, and even now, embraced us and said, yes, that's a great question.
I have a question. I mean, I'm all for this. Ben said, I think, what we have a 52 or something like that of our kids below the poverty line in school. There's definitely need for healthcare services for people that don't have the money. I have cancer. I know what it's. I mean, you know, thankfully I'm well insured and all that. But I know that there's many people. I was just at the hospital the other day, and the doctor said, you know, there's people, and he has patients that don't have insurance, and they die before they figure out a health care plan so that they can get to an oncologist. And he said it happens several times a year. And but what I'm asking is you mentioned the $1 a year in Karnes City for the land. I mean, something like that, you know, for 10 years, I think you said, could you bring that information? I mean, obviously y'all agreed to it, so it's a workable plan. Could we come back and you bring that information to us, and so that we can have options? You know, it's a good way to start looking at helping y'all get here. Because I'm all for it. I mean, we've had that 2 acres over there. We haven't had serious lookers.
What specifically, Mr. Monte, are you looking for? What exact, how much land do you need, or?
2 acres would do it. We're currently at 3.5 acres at the Pleasanton site. We built a 20,000 square foot facility there.
Well, some of this is in the floodplain over there.
Oh.
So there's some runoff, there's some other things, but
Okay, that's,
yes.
that
What
helps a
location
lot.
are we looking at?
They're looking at the one on Lono.
We dealt with that with Karnes,
so-
yeah.
But not only that, but if you're looking for future growth, can we look at the city plan? Like, you know, I remember that back a long time ago, they put, you have the Health and Student Service Office. So if we had land over there, just different locations, and if they need to walk, they could walk right next door.
Yes.
You know, instead of having to transport and do things like that, because
That's a great
transportation is
idea.
an issue. So I mean, I know there's other locations. I don't know if you've seen them all, as far as, you
I've
know.
seen the one over there quite a few years ago that we were looking at that.
And then by the VA home, I know where they put the new assisted living facility.
Where is the location you're looking at?
But we were looking at the one off the Lono.
Where is that?
By
Right in Helicis, right behind the car lot, Peninsula Motor.
Yeah.
Why wouldn't we look at by the VA home?
yeah.
Where all the medical-
That's
Tommy
what I
just
would
told
think.
me. Tommy just brought that to my attention today,
Yeah.
and so we're definitely open for
I mean,
that.
it's not, I mean, the post office is down there, the
There's some
VA
senior
home.
apartments
The
there.
senior
Yeah.
apartments are right across the street
Yeah.
where they might add on and build some more. The assisted
That's-
living is right
That's
there.
excellent, that would be an excellent.
That was just
I
more of a
mean, it's
medical
not highway,
check.
it's not highway frontage, but you don't really have frontage where
Doesn't
you're
have to
at.
be.
Right.
But, I mean, I would be very amenable to doing something over
And I
there.
think the Children Bereavement Center is working on a deal to get that little building in the front across from the post office on
Okay, I know
Walnut
which one you're
Drive.
talking about.
So, you know, there would be a lot of traffic there.
That would be great with
That would be
our
great.
relationship with Camino Real.
Yeah.
I mean,
Yeah.
we are besting out of our current space
Yes,
in
we
the
are.
strip center where we're at right now.
Yeah, I just knew like before I got on the board, there was a future plan of, maybe Fred can enlighten in the past, that the reason I did that, when they did the Health and Human Service office and expanded the road and did the assistant living, and then they had the low-income senior village right there. I mean,
Related kind of.
related services, you have the VA right there that are some, and then you have the new
That would
memory
be
care units
awesome.
That would be
Yeah.
more.
that they're
ideal.
gonna expand like phase 2
That would
and
be an
3.
ideal place there.
So it's all
I
medical.
think you're right.
Is it a purchase or
But let me just say,
What?
purchase?
Monty and I visited maybe a year after I'd gotten here. And the board at that time
The one that's on those board.
was interested in them going, I think, where the memory care and assisted living is. But it was market priced, and that just took them out of
Yeah,
contention.
we
Right.
Couldn't do it.
What, like you brought up the good, I mean, what you brought up about a good point about with the Carnes and stuff. We also partnered with McMullen County. The county judge was looking, they went to the Baptist, to the Methodist, and to us, and so forth. How can they get health care in McMullen County? Well, we gave them a proposal, that they went, and they were able, and we worked with their lawyer and stuff, because you gotta work through the lawyers, and get through with that. And they did it, and they bought a house for us, renovated it, and gave us nothing. I mean, we moved in there, and now we have health care 5 days a week. And
I think Scott was on the right path, maybe
So we're
bring some of
definitely
those
wanna work with you
contracts
guys.
that y'all have done in other counties, so we have something to review
Yeah.
and go upon and based upon it, and then, you know, I can talk as a school social worker, and Scott was right, we're at 52, I think 0.6% economic disadvantage, and there's 4,011 kids if you do the math, because of average low poverty due to free and reduced lunch, so anything we can do to expand that healthcare, and like I said, no one's really missing out, they're just getting a gap, they're servicing a gap where people are maybe not getting insurance. I mean, not getting insurance, but getting medical.
I have, this is off subject, but it's kind of just burning a hole in my head right now. I mean, I didn't know y'all existed. I honestly, I had no idea y'all existed.
They've been here for about 8 years.
Yes.
Huh?
Yes.
Yeah.
I grew up here, and every time I talk to somebody, I am teaching them about our services. And
Yeah, I mean,
I just want to get on the football field already and say,
They all-
oh gosh, we're right by Tractor
I mean,
Supply.
Used to be the old
I
drugstore.
mean, is there some kind of outreach program where you can do mail outs? I mean,
That's what
you
they
can
did.
literally mail 80% of our town,
I've been
and then
doing,
Give me your phone,
somebody
I'll
in
tell
the
you.
household that we
I've been
want.
doing some outreach with the food bank as well. We've been, with the food distribution where there's 2 events, one in Polk, one here, that we partner with, we help deliver food. And so when we do that, we put our insert of our flyer in there as well. I also been partnering with, we have the health fair that we do here, that we'll be doing in July here as well with Conley, partnering with Conley and Pride Services
There's a
and
5K on Monday.
Camino Real, but we are trying to get our name out there. Today we did I took Dr. Thompson around and kind of, showed her around, but we are trying to get through the school as well. We're doing presentations through the school, and Chamber of Commerce, yes, so we're
But I mean,
trying.
a few signs in some areas of our town might really bring in,
And sometimes you can say, adjacent to the.
No, I'm not afraid of them finding it. What I'm saying is I was born and raised here, and I had no idea that this thing even existed. I mean, I've been to city council meetings where.
You go to church every day, you wouldn't be bored?
Don't worry about it.
Okay, hold it back together, guys. Yes, ma'am.
So you're looking for a site, you're looking for
We're
like.
looking for a site, we're looking for a partner that will partner with us. We're a true 501c3. I mean, we don't have a lot of money, we do really good, we do a little bit better than break even within there, we grow, we do.
Well, Community Real came and did the same presentation about a 60-bed facility, and they built it in Lionel and missed out, just because we didn't help them with some land, and it created over 80 jobs.
Well, it's a different board, different
Yeah, I know.
council.
So
and-
I would say to move it along, if we could just, like, I don't know if there's an action on it, I would vote to look at it, move forward as a possible project with future, documentation from Wilson County.
But I would just like to add that we need to, I mean, maybe look at other land options.
Definitely.
I mean, I wouldn't be opposed to if we found something affordable to buy it and put y'all in a better location, because I can see the need. I mean, I know a lot of my friends don't have health insurance.
We take walk-ins.
Yeah.
Come on in tomorrow.
Sunday appointments.
How many of y'all sometimes you don't wanna?
The next to assisted living and nursing home in the post office,
Maybe
we're in
we
a pretty
could-
good spot.
Yeah.
We can put you out here in the parking lot.
But we don't know.
We don't have to do that.
And then we have 4
Cut
acres
down on our
behind
paving.
And on Tuesdays, we're open until.
I got a question,
10.
yes. So bottom line, what are you looking from us in numbers and things that you can give us at this point?
property.
Property.
Property, but
Property. If
you're
we can get
you're
property,
asking to buy, or you want a grant on it, or what?
we would like to partner where we don't have to buy, I don't care if you maintain it, and we do $1 a year forever. You know, our board is pretty much open to what we can do within it, that's what I tell, you know, we want a true partner. We gotta go out to USDA, if we go out there, they wanna say, well, do you own the land and so forth. That's why the city of Corinth was going to give us the land that we were at. But
It's just
you
being
said the
stakeholder.
bad people
Yeah,
were.
and again, you know-
We haven't said the flood zone, that's why we didn't do that route. And so we had a couple of community members, of 3 brothers, the Cruz brothers, because you know how expensive property is with Eagle Ford Shell went through the brook. Well, they gave us a sweet deal on 1.66 acres right off of Panama Maria Street, and we couldn't, the board couldn't say no. It was a real good deal within.
Well, like, Tommy, the land there by the veterans home.
Yes.
Everybody says VA, it's not really VA, but
Well,
it's
the
veterans home. Is that our land?
Yes. We own
What are-
5 lots out of 6, and each lot is .81 acres. So total, it's 4 acres. So 2 lots, between 2 and 3 lots would be his 2 acres.
And you've seen that, and you say that's
No.
okay. Now, how do we get from where we are, you know, we've got land there, I know we need, or think we need to sell it for a certain amount or whatever, and here's a person that has a business that maybe we need in Floresville, we wanna have, can we get together and provide some kind of I don't wanna say deal, but some kind of a proposal here where we can meet at some point?
Yes, and what
Because you
I would,
mentioned, excuse me,
what I
you
would
mentioned,
recommend is that Monty and his staff take a look at the land we're talking about in front of the Veterans Center, and then our Veterans Home, and then come back to us with a proposal for, if they can do it that fast, in April.
Do multiple proposals.
And then we can look at the bones of what he's proposing and say, that makes sense, and, you know, then the big question is just, how do we do this? But I will get direction from Clarissa whether the board can do a land grant for nothing, here's 2 acres, or $1 a year for 10 years, whatever she says, you know, rules.
Yes.
But I think then we can come together pretty quickly.
Well, because you mentioned, you know, price kind of market value or whatever, you know, but that's flexible, right, for us?
Oh,
That's
yes,
flexible.
yes.
You should get at EDC project, you can
Our
go
la-
any.
our latest price was $30,000.
But my point is, you actually can go anywhere from there, all the way down to $1 a year, forever, I mean, whatever. But it has to meet certain requirements for us to,
Right, and that's what I'll get from her, but.
well, but I'm not talking about the legal thing. Is it an investment that we benefit from enough to be able to do that kind
Well,
of thing?
4B as opposed to 4A can fund public improvement projects. I think with, and having her take a look at this, but for my gosh, I think this is so essential for a community like Floresville to have this kind of service available to all of our citizens is the highest order of public service to me.
Absolutely, I think so.
But I'd get her,
But again, I don't think it's the value of the land, market value that should be a factor here. Because we can.
It's not, we're not tied to any price.
No. So if it's really this good, then by all means, let's get working on it.
I mean, if the board, and maybe, I don't think the board's meaning that way tonight, but if the board said, you know, we want $20,000 an acre, Monty's gonna pass it up.
But nobody's saying that.
Yeah, and so,
That's my point, you don't want to hear figures like that.
Let's just go with the route that Scott said.
Yeah.
I would make the thing to say, to move forward, to continue with maybe a future project. If Monty comes back to us with multiple offers that you made, maybe like you said, in McMullen, Karn City, something Tom you can review, look at, report to us, and then we invite him back.
Yeah, I mean, because that would give our attorney kind of an insight into where y'all are wanting to go and to see how other attorneys drafted it up, which maybe save us $20 on
But
legal
make sure we
fees.
don't lose it.
Yeah.
What's the best way to go, Mr. Small, with, based on USDA funding, what's the best route to go, with a purchase or with a lease? What's,
Yeah, I mean,
A purchase is the best, not a lease, because they look at that, we own the land and stuff, they've been there. That was one of the challenges we had in Karnes, the lease, we had to stop it, and the council decided to give us the land there to build it, but we ran into flood zone. And the flood zone was prohibitive in trying to fix that flood zone to build a community health center. So we had to give up that, and so they helped us find the other one.
okay, I think there's a consensus built on the table that you look at the VA.
Okay?
You work with Mr. Baker to look at the best possible site for your location. And let's do this as quickly as possible.
yeah.
And there's opportunities that this part of the city can do things with you as far as fees,
No
or
discussion.
permits, things like that to move forward. But I think you just need to go with the land first and come back with it.
Yeah, no,
Nobody here's pricing anything at X an acre.
and we have, water and wastewater in the ground behind the curb, so we don't have to wait on that.
that's, you
It's
leave the money here.
Good streets.
As soon as you close.
I think we all understand it.
Good streets,
Yeah.
everything.
We're good, are we gonna make a motion, are we good? Or we just get direct?
I'll
Bring
make a
that stuff back
motion,
and we'll.
I'll make a motion that we allow Mr. Baker and Mr. Small to move forward with a project, preferably at the Veterans Home site location, and that you come back as soon as possible with a formal proposal.
Second that.
Have a motion by Danny, a second by Fred. All in favor?
All right.
Aye.
Opposed? Motion passes.
Thank you all so much.
Thank you, thank you.
Thank you. Great presentation. Thank you so much.
Then we have a.
Yeah. How many times we go around the circle on that? I felt like we interrupted what we started.
Stop throwing numbers down.
We're in agreement.
Okay, so we need to get
So we have an event on Monday at the school, you know, whatever, and then we need to actually, if you want
We're
to,
gonna take a short
we have a
break.
school advisory committee